Good afternoon to all of you, and welcome to Capdoula webinar. So this is an important step for us as it's our first webinar in English. So some of the participants are regular attendees. Some of you are totally new, so welcome, and thank you for joining us. As you can guess from our name, our webinars are always about pain management. And for this first webinar in English, we're going to talk about pain and surgery. So I'm pleased to welcome the three lecturers for today, Professor Viguier, Dr. Philippe Buttin, and Dr. Thibaut Cachon, who are going to share with you some of the latest innovation in surgery, innovations which, amongst other advantages, can significantly help in reducing post-surgery pain. So the lecture will last approximately 40-45 minutes to save time for the question at the end. So if you have questions raising up during the lecture, please use the chat and we will answer as many as we can at the end of the session. So I'm now handing over to Victor Roballo from Novetech Surgery, our partner, who's going to introduce the session. Enjoy the meeting.
Thank you very much, Laetitia. So I'm Victor, the CEO and the co-founder of Novetech Surgery, and I will just briefly, say thank you to Capdoula for the organization of this webinar and to all the surgeons for their participation and all the attendees. I will just briefly present our company, which has been created in few years ago in Monaco and which is benefiting of several decades of experience in human implant manufacturing. We decided a few years ago to dedicate this know to the veterinarian surgeon and to help them to maximize the benefit of this treatment or to minimize the animal pain, trauma, and recovery time. And this is why today, three surgeons will present you the physiological technique we developed for CCL repair, for tendon repair, or as well how we can manage the pain in post-operative surgery with cryotherapy breaks. I will now let Viguier, which is from the University of Vetagro in Lyon, France, who is working with Dr. Thibaut Cachon in the same university, and then Dr. Philippe Buttin will talk about the tendon. Philippe Buttin was a referral activity in the French Alps in France as well. For the moment, I don't see any questions, so we can move to Dr. Thibaut Cachon, who will deal about the cryotherapy brace in post-operative pain management.
Okay, so good morning, everyone. I would like to thank you, all of you, to be there to attend this meeting. I will try to be fast and to introduce you the cold compression therapy that we develop as a brace with Novetech. And as you all know, cryotherapy is next slide. As you all know, cryotherapy is the application of cold in rehabilitation and physical therapy. You can associate cold and tissue compression in order to improve the efficacy of cryotherapy. Next slide, please. Cryotherapy is mainly used to decrease pain, to decrease inflammation, but also to reduce edema. And it's most of the time, there is, you can change slides. Sorry, Victor. Thus, cryotherapy is used to reduce inflammation by reducing the metabolic activity by inhibition of inflammatory enzymatic reaction, and also to reduce release of histamine. This also protects the tissue from damage. This reduction of inflammation is also increased and is also added because of vasoconstriction, which is induced by cryotherapy. This vasoconstriction induces reduction of inflammation, but also a reduction of the edema, which would be very interesting to decrease pain, because edema, tissue edema, is the main component of pain in traumatic injury. At least, and not the at least, cryotherapy is also used to reduce the nerve conduction velocity, which will increase the analgesia in post-operative care or in traumatic injury. If you compression to cryotherapy, you will increase the vasoconstriction, thus increase the radius of edema, but also increase all the effect of cryotherapy. Thus, compression and work as a synergy with cryotherapy. In human beings, next slide, please. As you can see on this picture, that the efficacy of cryotherapy is increased by cold compression. You can see on the right of the picture that cold compression therapy induces a larger diminution of temperature in the knee of a dog rather than a standard cryotherapy. And it is well known in human beings that you need to get at least decrease of the temperature more or less to 16 to 18 degrees after the cryotherapy to get some efficacy of the cryotherapy. Thus, cold compression therapy is very interesting to improve the efficacy of standard cryotherapy. As you can see on the next slide, in human being, there is very very specific techniques to do cryotherapy. That could be used as some brace, specific brace for each joint, but also there is some mechanic cryotherapy units which can be in post-operative care. Thus, unfortunately, those specific units are very expensive and most of the time are not very easily to use in dogs. And to the next slide, please, Victor. And thus, we try with Novtech to develop a specific brace in order to do some cold compression therapy, which will be a brace specific for dogs and specific for stifle in dogs. There will be three sizes, from one size for the dogs between 15 to 95 kilograms, the other and two other sides, and then you can treat dog between 15 to 50 kilograms. It's quite easy to apply, and there is the left and the right side. The brace is used mainly in two situations. As you can see in the next picture, the brace is mostly used to treat acute musculoskeletal disorder, for example, sprain. But in my practice, I mainly use the brace to treat post-operative pain and edema after stifle surgery. As you can see in the next slide, you need to use for the brace during 10 to 20 minutes, 2 to 3 times a day, and the compression need to be done by 5 to 10 pressure into the brace. The brace is mainly used during the acute phase of inflammation. Thus, for the first 4 to 5 days, it is mandatory to use it as soon as possible after the injury. Thus, as soon as possible after surgery, if the brace is used for a post-operative care. There is very few contraindication to this brace. I think that most of the time it's more precaution of use. You need to protect the skin with a towel before to use the brace. You also need to avoid the use of the brace when there is an open wound or where there is some skin with ischemic area. How I use the brace in my practice, I think that currently I use the brace in every stifle surgery, such as TPL or TTA or into stabilization. But also even after simple arthroscopy or treatment of patellarization. I use the brace, as you can see on the slide, as soon as possible just after surgery. During the waking up of the dog, just after the X-ray, the dog gets his brace during 20 minutes just after during the wake phase of the dog, which will increase the efficacy of the cryotherapy, is to use it as soon after the injury. And then I use the brace, as I already said, at least 2 to 3 times a day during 10 to 20 minutes each time. And I use it at least for the first. You can use it a little bit more, which which is also possible in human beings. Sometimes they use the cryotherapy during 10 to 15 days after surgery. It's quite easy to use. I think that there is new way, perhaps new perspective by using those brace, which could be using this brace in a preoperative therapy. As there is a study who show that using the brace before the surgery could be more efficacious than using it just after the surgery. We need to keep on going on this, perhaps to use it as a preemptive analgesia before the surgery. And I think also that the brace could be used in other kind of joint. I use it also, for example, in tarsus or in elbow. For example, in elbow, in post-operative care after elbow arthroscopy, the brace is quite easy to use also. As a conclusion, I would like to thank, first of all, Novatech to develop this cold compression brace, because from my point of view, it's clearly a part of the multimodal analgesia of the dog in stifle surgery. The brace is very easy to apply and is, compared to other brace available in human being, is very cost effective in small animal practice. I would like to thank you for your attention. If there is one or two questions, I can answer quite easily.
Thank you, Dr. Cachon. So we can check in the chat if there is any question. And for the moment, I don't see any. So we can move on to Dr. Philippe Buttin for the tendon reconstruction, and we will check for all of your free presentation if there is any question at the end of the conferences. Thank you very much, and Dr. Philippe Buttin, the floor is yours. So let's check if there is any question.
I think that there is one or two questions about the brace. I'll check it on the chat. The first one was if there is any concern about loss of temperature by using the brace just after the surgery. In our practice, we didn't get any problem with the loss of temperature during the waking up phase of the dog with cryotherapy. That's mainly a local hypothermia, and I think that there is no contraindication to use it in during this phase of the waking up. Of course, you need to keep the dog with a good temperature just for the surgery, but it's not a concern for me to use a cryotherapy brace during the phase of waking up. I think it's not a big deal. The other question was about cost of the brace, and I think that Manuel and Victor will answer to that question directly, because it could be different from one country to another one. Okay, if there is no other question, no, it's a thing for me.
Definitely, we invite you to any price or technical information on the product itself to contact directly the company or Manuel Garcia that has left his mail address into the chat. And we will either give you a direct answer or send you back to your local distributors. I don't see any other question regarding cryotherapy brace, neither regarding ligament or tendon reconstruction for the moment. All right, there is one question for cryotherapy brace by Sarah Olemans. Should these braces be frozen or cooling?
Yes, in fact, inside of the brace there is a cooling pack. You need to put it in the fridge for 1 to 2 hours, and it will keep more or less a good 4 degrees during 1 or 2 hours after the use of the brace. So it's you need just to keep the pack in the fridge.
Thank you.
Okay.
Well, if there is no other question, I think we can finish now. Thank you very much to the three of you for your conferences and for the time you spent into the question and answer time as well. Thank you to all the participants to this webinar and to Capdouleur for its partnership for this webinar as well. You can access to this webinar as a replay video as well. Novetech Surgery will try to implement webinar each month because of the period we are living right now. Webinars is a good way of sharing experience. So thank you very much, and we hope to see you again in the next one.
Thank you. Bye.
Thank you. Bye-bye. See you.
Thank you.